For many, many years, probably for a century, surgeons thought polyps were tumors in the nose, and tumors have to be cut out, and then the problem has been solved. Unfortunately, especially in the last 2 to 3 decades, we learned that polyps is an inflammatory disease that is part of a spectrum of diseases together with a severe late onset asthma, part of chronic rhinosinusitis, and that it's an inflammation. And you can imagine that, contrary to a tumor that you can just take out and solve the problem, that an inflammatory process that you cut away will come back. And for that reason, surgery very often is very successful on the short term, but especially in chronic rhinosinusitis with nasal polyps, comes back over time and has to be redone after a number of years, and again and again. Some symptoms, like for example loss of smell, are very badly treated with surgery and always need medical treatment after the surgery to reduce the inflammation and improve the symptoms. Essential for long-term treatment of chronic rhinosinusitis with nasal polyps is always the anti-inflammatory component, so the medical treatment. And that can be combined with surgery, because surgery gives a new start. It can be very effective, but eventually the anti-inflammatory component is absolutely necessary, and that usually consists of local corticosteroids as a spray or as nasal drops in saline rinsings, sometimes also systemic corticosteroid treatment or antibiotics, and now the last few years we have new treatment with biologicals that are very effective, especially suitable for patients with very severe disease. Chronic rhinosinusitis is an inflammation of the airways, with or without nasal polyps. Different forms, different endotypes, different forms of inflammation, but all inflammatory processes. And of course it's very understandable that an inflammatory process of airway mucosa, the inside of the nose is covered with mucosa, like skin on the outside, and the same mucosa is also part of the lower airways of the lungs. And it's stranger actually that you can have an inflammation of the upper airways without having it in the lower airways than having the disease in the whole upper and lower airways. And for that reason, the more severe the disease is, and that is true for the upper airways but also for the lower airways, the larger the chance that it actually involves the whole airways. And patients with severe chronic rhinosinusitis with polyps, for example, have more than 80% chance of also having asthma, and vice versa, it's almost the same.